Welcome to 4sight Friday Roundup, 4sight Health's podcast series for healthcare revolutionaries. Outcomes matter, customers count, and value rules. Hello again, everyone. This is Dave Burda, news editor at 4sight Health. It is Friday, August 27th. Right now, everyone's favorite football team has a perfect record. Enjoy it while you can. On today's episode of the Roundup, we're going to talk about COVID-19 and money. Specifically, we're going to discuss how the resurgent pandemic is affecting healthcare from a financial point of view. We're going to talk about patient volume, the cost of COVID hospitalizations, health insurance premiums, and more. Today's COVID healthcare economics lesson is being taught by Dave Johnson, founder and CEO of 4sight Health, and Julie Murchinson, partner at Transformation Capital. Hi, Dave. Hi, Julie. How are you guys doing this morning? Dave?
Did you mention football? When I woke up this morning to do the show, it was dark outside. And even though it's going to be 90 degrees today, I know that winter is coming. So I probably have a feeling of foreboding this morning, and that may be the right frame of mind to have this talk about the resurgent pandemic. Foreboding is also the right word to describe my feelings for the Minnesota Vikings, my favorite football team. I think their season's going to be a mess.
Yeah, it could be a rough one. Thanks, Dave. Julie, how about you?
I'm doing well. I was actually in another surreal experience this week at a small conference that required vaccinations, required testing 3 days in advance, tried to create as much of an outdoor safe space as possible, and it felt a little bit like the old times. Not so bad.
Okay. And you feel you sailed through safely there?
Well, we'll find out, won't we?
All right. Good luck.
It's a bubble, Julie. It's a bubble.
Let's hope.
Now, before we talk about COVID and money, let's talk about the pandemic generally. What positive signs do you see? What negative signs do you see? Dave, what happened in the past week that gives you hope? What happened in the past week that gives you pause?
Honestly, Dave, I didn't see a lot in the last week that gave me much hope. The Delta variant is surging. There's new concern about the Lambda variant, which the vaccines may not be as effective against. We're about to head into flu season. This doesn't look like it's going to end anytime soon. The societal response to prolonged COVID is uneven at best. Inflation is up. People are sick and tired. And as I said a moment ago, I guess winter is coming.
I guess I'll have to figure out how to type the word twindemic. Does it have a hyphen or is it one word? We'll find out. All right, Julie, what's pushing the needle in the right direction? What's pushing the needle in the wrong direction?
Well, literally the signs I saw this week on the news that say demask our children. That's not a good sign. I don't like that sign. I am encouraged, though, by your state, which I understand is now requiring vaccinations for all healthcare workers, whether state funded or not. So I do get excited to think about how mandates can be a little bit stronger in this time.
Yeah, thanks, Julie. For me, it's the pushback from parents to mask mandates for kids in school and the pushback from employees to vaccine mandates by their employers. Yeah, I thought it was just the crazies, but the opposition to basic public health measures is more mainstream than I thought. And that tells me we have a long, long way to go before we get out of this mess. We'll see. Okay, let's talk about COVID and money, and let's start with COVID and patient volume. An analysis of data from 250 hospitals by the Kaiser Family Foundation and the Epic Health Research Network, which I didn't know existed, found that patient volume didn't rebound in early 2021 from deferred care, as many had predicted, and of course, along with it, patient revenue. Dave, do you think the patient volume will rebound eventually, or are we witnessing a permanent change in how patients use hospitals? What's your big takeaway from the report?
It's complicated like so much in healthcare, but I do believe there has been some fundamental shift in healthcare consumption patterns, and that will result in lower utilization even after the pandemic has receded, lower hospital utilization. On the volume side of the equation, the Kaiser analysis of the Epic data found that hospital admissions were down almost 15% in early April from pre-pandemic levels. Factoring out COVID admissions, hospital admissions overall were down almost 20%. 20%, big number. Explaining the decline is complicated because it reflects a combination of delayed care, which will come back, foregone care, which won't, and care previously delivered in hospitals that's now delivered outside acute settings, virtually in the home, in clinics, and so on. A lack of available healthcare workers in some institutions and markets may also be suppressing demand, and that will fluctuate as the market shifts, but it's there as well. Some people foregoing care will come back sicker. That's bad. Many foregoing care will do just fine, either because they've recovered without it or it wasn't necessary in the first place. That's good. Finally, alternative care delivery is here to stay. That's also good. So putting it together, it's highly unlikely hospital admissions will return to their pre-pandemic levels. On the revenue side of the equation, Kaiser's analysis of the Bureau of Economic Analysis data found that the personal consumption expenditure, that's PCE for the economists in our audience, was down 7% for health services and 4% for hospitals through June of this year. This is a worrisome trend for hospital administrators. Hospitals are labor and capital intensive. They operate on tight margins. Volume and associated revenues are declining and probably not coming back. Hospital subsidies from the CARES Act are running out. There's a little appetite in Congress to provide more. If recovering volume was a hospital administrator's plan A, it's definitely time for them to formulate and execute a plan B.
Got it. That's great. Thanks, Dave. Now, Kaiser released a second economic analysis that said that hospitalized, unvaccinated COVID patients cost the healthcare system $2.3 billion in June and July alone. Julie, who pays for that, and what are the long-term implications for the health system? How much more can the system take from a financial point of view?
Well, there's so much wrapped up in what's happening with this right now. When you look at some of the numbers, Dave, I was shocked to see some of this. More than 98% of the people hospitalized between May and July were unvaccinated. So what does that mean? Our healthcare system is paying, what was your estimate, $2.3 billion?
Yeah, $2.3 billion, yeah.
For personal choice and the illness that was created. So we talk on this show a lot about our sick care system and moving to a healthcare system. And this is just the epitome of personal choice that could have prevented what happened to them potentially, that's now created a ton of downstream costs. So it would be one thing if we thought, oh, well, those people who made that choice are paying for that. But we all know in this system that we as employers and taxpayers are now paying this $2.3 billion bill. And I think this is starting to become, a big economic issue. I also, when I read what's happening with hospitals, predominantly in the South and certainly in Florida, the combination of the influx of patients and now some of the vaccine mandates on the part of healthcare systems is causing massive unrest in the clinical workforce. So you're seeing a lot of people quitting and leaving their health systems, quitting those who are mandating and going across the street to others who are not. And I think we talked about this on the show a few weeks ago. So we're also starting to pay more for how those hospitals that are left unstaffed staff up, because that's very expensive when you have to do that. And the lack of staffing is forcing a lot of those healthcare systems to close beds. So we're not actually getting care to people who need it. So we're paying a huge economic cost as taxpayers, and we're paying a huge cost in what the health of the unvaccinated people who are in those situations becomes because they're not getting the care they need.
Scary stuff. Thanks, Julie. Dave, anything to add to Julie's comments?
Nobody likes free riders, huh, Julie? On a positive note, since we've been pretty negative to this point, I read an interview this week with Eduardo Coronado, the Ascension's Chief Strategy and Innovation Officer, on the system's post-COVID market positioning. And under Eduardo's leadership, Ascension is emphasizing consumerism, shifting surgeries from hospitals to ambulatory settings, standardizing protocols, and doubling down on patient-friendly virtual care, all with the long-term goal of engineering integrated delivery capabilities that enhance broader population health, particularly for underserved populations. Ascension was already doing much of this pre-pandemic, but under Eduardo's leadership, they've engaged in a form of proactive crisis management during COVID to accelerate adoption of the transformational strategies I described above, and to make those strategies become a permanent part of their delivery network and their business models. This is the type of clear-eyed management response I'd like to see within health systems overall as the industry's supply-demand dynamics shift. In Ascension's case, Plan B has become Plan A, and good for them.
Interesting. A silver lining. Thanks, Dave. Now let's talk about the pandemic and health insurance premiums. The second Kaiser analysis said health insurers are starting to reinstate copays and deductibles for COVID patients. Julie, how do you see the pandemic starting to affect the business models of health insurance companies? Where is this headed and why?
Well, I think what you're referencing, Dave, is that nearly all private insurers, somewhere between 75 and 90%, initially waived costs of hospitalization for COVID. But since the vaccines have come out, a lot of them have rolled that back. So now what's happening is this very interesting and almost ethical question about whether there can be some sort of, just like for smoking, how if you're a smoker, your premiums are more. If you're unvaccinated, can you actually be charged higher premiums? I've talked to a lot of small and large employers who are exploring this. Talked to an attorney this week who says it's completely legal. So I think we're starting to see some very strong economic incentives being discussed at a personal level to really make that happen. And, I think we're starting to see some large employers who are being very vocal in the news. Delta is one of them, who's going to charge their employees $200 monthly surcharge if they're not vaccinated. So what I like about this is we've talked in the health insurance market for a long time about dynamic pricing. And there have even been some innovators over the last, 10 to 12 years who have explored dynamic pricing for health insurance premiums. And this, might really bring to the fore that discussion in a more scaled way.
Thanks, Julie. Dave, Julie brought up employers. They do ultimately pick up the tab through higher premiums. What do you see them doing to mitigate the economic hit? And where is this headed and why?
I can't seem to get through any of these shows without a musical reference of some kind. And you may remember that Liza Minnelli and Joel Grey sang the song Money Makes the World Go Round in Cabaret. In healthcare, self-insured employers pay the premium rates that make the provider and payer worlds go round. So when they speak, healthcare listens, and large self-insured employers are frustrated with employees who won't get vaccinated to prevent themselves and others from getting COVID. So let's look at the airline industry. All airlines are encouraging their employees to get vaccinated. Some, like United and Hawaiian Airlines, have instituted vaccine mandates. Others, like Delta and Frontier, are requiring non-vaccinated employees to undergo weekly COVID tests. And as Julie mentioned, Delta took the additional step of charging non-vaccinated employees $200 more per month for health insurance to help offset their costs. And like she said, that move is equivalent to charging smokers more for their health insurance. And I'm intrigued by the concept of dynamic pricing that Julie mentioned, the idea that we might expand this concept of personal responsibility to really reward people that are more proactive and engaged in managing their health. I can tell you from the union perspective, they don't like mandates. They don't like higher insurance premiums. They don't like any of their members being discriminated against. So this battle is far from over, and we'll probably have some high-octane debate associated with it. But overall, I read these dynamics as part of a broader national debate linking freedom and individual responsibility, not only in healthcare, but broadly throughout society. As I mentioned earlier, America doesn't like free riders, but the nation also values individualism. So I don't think there will ever be an absolute requirement to force individuals to get COVID vaccination, but there's an emerging consensus that there are financial and behavioral consequences to not doing so. And maybe, just maybe, it will help our country recapture its sense of the greater good. That would be a silver lining in an otherwise very dark COVID cloud.
Got it. Thanks, Dave. Julie, anything to add to Dave's comments?
Gosh, I couldn't agree with Dave more. The only other thing I saw was that we're starting to really now see unemployment benefits potentially being impacted here. So if your job requires you to be vaccinated and you don't get vaccinated, you can be fired. And in unemployment law, to receive those benefits, you have to prove that you're out of work at no fault of your own. So it's one of those gray areas now. Is it your fault that you were fired for not being vaccinated? And we're starting to see this become an issue. So, I think personal incentives are really pointing in all directions to getting vaccinated.
Got it. Thanks, Julie. I know I don't want to pay more for healthcare because someone didn't want to wear a mask or get vaccinated. That should be my right. But maybe somebody out there is paying more because they have pizza every Friday. So I don't know. It's a tough one to resolve. All right, now we're going to do a little something different on the roundup today. Instead of me asking you to predict the big healthcare story next week, tell me what other big healthcare story caught your eye this past week. Julie, what happened this past week that told you a lot about where healthcare is going?
Well, I have two, actually. One is I saw that we're seeing a little bit of the Blue Cross Blue Shield roll-up that people have been talking about for a long time. Guidewell, Florida Blue, bought the Triple S plan in Puerto Rico. So it'll be interesting to see how all that comes together. But perhaps more immediately interesting to me in the behavioral health space is the Ginger Headspace merger. And in full disclosure, we were an investor in Ginger. But this one is very intriguing because A, with the rate that we're seeing behavioral health companies start these days, we were bound to see some M&A start happening here. And B, the Headspace Health, which is the new company, is really looking at a broader continuum where Ginger's kind of going upstream and they're creating a more comprehensive care model with global reach and a lot more consumers being impacted or part of the solution. So it's a very interesting one of all the companies that could have come together in the industry, and I'm excited about it.
Got it. Thanks, Julie. Dave, what happened this past week that's worth noting and why?
By the way, Julie, I love that name, Headspace, for the company. Reminds me of Max Headroom. I just think it's a great name for a company.
It is a great name.
It's actually a term in home canning. Do you guys do home canning?
I don't even know what you're talking about.
Canning peaches or?
Oh, no.
Okay, well, I guess I'm revealing more about myself than I should, but that's the amount of space you leave in the jar before you put it in the pressure cooker, Headspace, so it doesn't explode. So there you go.
Makes sense.
We'll do a whole show on canning in the future, right? So you're clearly preparing for the end times, Dave. My noteworthy event for the week was the FDA's final approval for the COVID vaccines. That's a really significant milestone. It eliminates the ability for individuals to claim that they won't expose themselves to quote unquote experimental treatments. It also frees organizations to take more aggressive measures like mandates, like many that we've discussed today, to increase vaccine adoption. So as you were saying earlier, it's getting harder to hide if you really want to maintain an anti-vaccine stand.
Got it. Thanks, Dave. And thank you, Julie. That is all the time we have for today. If you'd like to learn more about the topics we discussed, please visit our website at 4sighthealth.com. You also can find a recording of this podcast and all our podcasts on the Healthcare Now radio network, iTunes, Spotify, and other streaming services. Subscribe now and don't miss another segment of the best 20 minutes in healthcare. Thanks for listening. I'm Dave Burda for 4sight Health.